Welcome everybody to this month's installment of our Orthopedic Minute. My name is Bob Keel. I'm a PA that works with Dr. Corey Colstead, who's our orthopedic surgeon here at Memorial Hospital of Carbon County. Today I'd like to discuss what happens before you have surgery. So you come in, you see me, we talk, you see Dr. Colstead, and we determine that surgery is needed to help. Well, a lot of things happen from the time you leave that appointment to the day of your surgery, and I kind of wanted to go over that so that when this process happens and you get contacted, you know why people are calling you or what the purpose of that is. So when you have surgery, not only are we responsible to fix or to repair or to operate on that specific bone or joint, the nurse anesthetist that puts you to sleep is also responsible for the rest of your body. And so we have to determine that although you might have a problem that needs to be fixed, let's say it's a broken wrist, your lungs and your heart and your kidneys should be healthy enough to have surgery. And if they're not, that can pose a problem. And so if your heart's not healthy, your wrist isn't that big of a deal anymore with that fracture. And so oftentimes when you come in and we determine you need surgery, that very visit that you have surgery, that I determine you need surgery, we'll draw some blood work and get an EKG. What the purpose of that is even if you go to the doctor often and you're healthy and you don't have any problems, we still want to prove that you're healthy, so that there is no question that when we get you in the operating room, you're healthy enough for anesthesia. And so the blood work we do is checking your red blood cells, your white blood cells, and your platelets to make sure everything's okay there. We do another test that checks your kidneys and your liver and all of your electrolytes, make sure everything that looks good there. The EKG is to check your heart. The heart is an interesting organ, and it constantly changes, its demands constantly change. And so even if you had an EKG, let's say a couple years ago and everything was fine, you could have had some changes in your heart function and not even know it yet. And so we do an EKG to prove that in this time your heart looks good. If you have other health conditions, let's say diabetes, we would do a couple extra tests there, or if you had COPD, it may necessitate that we do a pulmonary test or a lung test. So after we get all that testing done, what is required is we will have you sit down with a family practice doctor and have them look at everything that we did. They'll look at the results of the blood, they'll look at the results of the EKG and any other tests that were done, and determine with you whether or not you're healthy enough for surgery. And so once we get that okay, that you're healthier enough for surgery, the process still isn't done. All of this information is then packaged up and sent to our surgery department, where the nurse anesthetist will review everything. If the nurse anesthetists have any concerns, then they will give our office a call, and most likely will give the patient a call and discuss that with them. The reason why the nurse anesthetist is the last line of defense is they're the ones that when you're asleep during surgery, they're responsible for everything else. If something were to go bad, it's going to go bad in their hands, and so they have the right and the responsibility to make sure that everything that has been done is sufficient and that they have no concerns or questions about surgery. And so that's kind of the reason why we do a lot of tests and preoperative screenings and visits with family medicine providers. It's just to make sure that you are okay for surgery. Now, our facility is a little bit different than other facilities in the fact that we're a small hospital, a community hospital, and we don't have certain resources here. Like we don't have a cardiologist that lives here and that could come in at a moment's notice. We don't have a pulmonologist that if something were to happen with your lungs, they could come in at a moment's notice. And so our facility needs to be a little more picky, a little more detail-oriented about a lot of these things that we're checking for to make sure that you won't have any problems here. You could go to a bigger facility and they might not be as adamant that you have, let's say, a pulmonologist workup or a cardiology workup, and that's because they probably have all of those resources on hand. And if you were in surgery and a problem happened, there would be somebody at the facility that could come in right away and take care of you. We don't have that access here, so we have to be very meticulous and careful that when we do surgery, it's not only the right thing to fix your pain or your bone or your joint problem, but it's also the right thing for your heart, your lungs, your kidney, and everything that goes on. And you can rest assured that our nurse anesthetists, our family practice providers are pretty thorough. And if they feel like that you're cleared for surgery, there's a really good chance that they've gone through everything with a fine-tooth comb and made sure that you're healthy. If they say, hey, look, I think we need some other testing, it can be frustrating, it can delay a surgery, but what you need to consider is ultimately that's what's best for you, because we don't want to create a problem that is bigger than the one we're trying to fix. And that's why we do all of this really in-depth testing before surgery. And so I hope this doesn't muddy the waters for you. It kind of answers some questions of why we have to do some testing before surgery and what happens behind the scenes with all of the people as we're preparing for your surgery. And that's this month's installment of our Ortho-Minute. Thank you for tuning in.